Principles of tooth preparation. According to Marzouk, tooth preparation is defined as mechanical treatment of dental tissue or chemical treatment which enables to accommodate a restorative material without incurring mechanical or biological failure. According to GPT, it is the process of removal of diseased and/or healthy enamel, dentin and cementum to shape the tooth to receive the restoration. The 5 principles of tooth preparation include preservation of tooth structure, retention and resistance, structural durability, marginal integrity and preservation of periodontium. According to Rosenschel, an optimal restoration will be obtained with a combination of biological, mechanical and aesthetic principles. Biological principles. These include prevention of damage to adjacent tooth structure, metal matrix around adjacent tooth. Positioning of diamond burr such as thin lip of enamel is retained and preventing damage to soft tissues by using careful retraction with aspirator tip, mouth mirror or flanged saliva ejector. Preservation of tooth structure is obtained by partial coverage than complete coverage when possible. Preparation with minimal taper and preparation of occlusal surfaces following anatomical planes. Marginal integrity. The survival of the restoration mainly depends on margins which have to be adapted closely to Carvo surface finish line of preparation. The configuration of finish line dictates the shape and bulk of restorative material in margin of restoration. Supragingival margins are above gingival crest. They are easy to finish as they are placed on enamel. They also have ease of evaluation and make impression making less traumatic. Subgingival margins are the major etiological factor in periodontitis. The deeper the margin, the greater is the inflammatory response. These are indicated when caries is present, aesthetics, or for need of additional retention. Finish lines are the point at which preparation terminates on the tooth. It is the peripheral extension of tooth preparation. The functions include evaluation of the accuracy of impression, helps in accurate die trimming. Used to measure of amount of tooth structure already removed, and it delineates the extent of cut in apical direction. The types of margins include knife edge, chamfer, heavy chamfer, shoulder, radial shoulder and bevel shoulder. Chamfer margins are obtuse angled, distinct, have less stress, and require minimal tooth reduction. Shoulder margins have wide ledge, minimizes stresses and are less conservative. Radial shoulder is a modified shoulder, with a Carvo surface angle of 90 degrees. In shoulder with bevel, an external bevel is created on gingival margin of finish line. Knife edge margins permit acute margin of metal. These margins are thin and difficult to wax and cast. Retention forms. These prevent the removal of the restoration along the path of insertion or long axis of tooth preparation. The retention forms include primary and secondary retention forms. The primary retention forms include sleeve and wedge type of retention, and the secondary retention forms include pin box and groove type of retention. Resistance forms. These prevent dislodgement of restoration by forces directed in apical or oblique direction. It also prevents movement of restoration under oblique forces. The factors influencing resistance include the following: dislodging forces, taper, which ideally should be 6 to 8 degrees, diameter of the tooth, height, type of preparation and luting agent. Structural durability. The restoration must contain bulk of material adequate to withstand forces of occlusion. It is confined to the space created by tooth preparation. Occlusal reduction provides an adequate bulk of metal It should reproduce basic inclined plane pattern of occlusal surface. A functional cusp bevel is given as lack of functional cusp bevel can cause a thin area or perforation, over-contouring and poor occlusion. Axial reduction is done to secure space for adequate thickness of restorative material. Inadequate reduction can cause distortion, over-contouring of axial surface and periodontal problems.